Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. Today, I am very excited to have sat down with two wonderful leaders in the County of Riverside here in California from the Department of Public Social Services and the Self-Sufficiency Department, which really focuses in on a variety of programs, including Medi-Cal Eligibility, which is a hot topic today in 2026, with changes this year and other changes coming down the pipe. In today's episode, I sat down with Allison Gonzalalez and Sandra Bowlan, as I mentioned, two leaders that help lead the DPSS department there in the County of Riverside, which has nearly 3 million residents and getting close to 1 million of those residents being on Medi-Cal. We learned about some of the changes coming up, including a twice-a-year eligibility verification that residents will have to basically stay up to speed on to maintain their eligibility, as well as some nuances for those individuals who may be undocumented between the ages of 19 and 64. We hope you enjoyed today's episode. And again, feel free to check out other episodes of Pop Health Podcast by visiting us on our website, pophealthpodcast.com, checking us out on YouTube, or listening to us wherever you listen to your podcasts. Thanks, everybody. Enjoy today's episode. Hello, Allison and Sandra. Thanks so much for joining the show today.
Hi, good afternoon.
Hello. Happy New Year. So audience, we are recording this right after the turn of 2025 to 2026. I had the chance to hear Allison speak at a Inland Empire Health Plan board meeting a couple months ago on Medi-Cal eligibility and what her team is doing there in Riverside County. And I thought it would hit home for a lot of us here in the state. And so again, Allison, really appreciate you joining and also bringing along your colleague Sandra to help educate us on what specifically you guys are doing there in Riverside County that might apply to other counties as well. Before we jump into that, I do want to get to know you guys a little bit, or you ladies a little bit. So we'll start with you, Allison. Can you tell us something preferably outside the workplace, like a fun fact, hobby, something like that might surprise the audience?
Yeah, I don't know that it'd be much of a surprise. Monday through Friday, a lot of my time is spent indoors. And so I am a very outdoorsy person. I love to hike and camp, garden, and I like to actually play and watch a lot of sports.
Okay, awesome. So do you know what tech wash is? This is regarding outdoorsy stuff. Have you heard of tech wash?
Like for poison oak?
Great guess. You mentioned outdoors. I was talking to someone just recently about waterproof like jackets. So like if you go hiking in rain, and I've just learned for like outdoorsy types, if you have a waterproof jacket that over the years loses its proofing, you can actually buy this like wash that you put in your washing machine, and it kind of rejuvenates the ability to be waterproof. So yeah, so that was on the outdoors. How about sports? What sports do you like to play?
I love baseball. I'm a huge baseball fan and played softball my whole life. So I'm a big Angels fan, and I'm also volleyball.
All right. Awesome. That's great. Well, I'm also somewhat of an Angels fan and hoping Trout, gets great again. So let's jump over to you, Sandra. Can you tell us something about you, maybe something outside the workplace, fun fact, hobby, surprise, something like that?
I think because we all work indoors, we all have the same aim, and it's to get outdoors. So I also love to hike. And one of my dreams is that when I retire, I hopefully get to explore as many national parks as I can. So that's just a little fun fact.
All right. Awesome. Have you been to any so far?
Most in California. So my goal is to get out of California and keep exploring.
Okay, awesome. And not to put you on the spot, but are you like a glamper, or do you do like real, like do you do overnight stays? Do you do tenting? Like
I'm a tent camper. Yeah, I don't glamp, but I can only do 2 days max. So
okay. Well, I'm really happy to hear that. I'm also a traditional camper. I don't do a lot of it. I used to growing up with my family, and a lot of my circles today are leaning more towards the glamping, and I kind of tease them. And but I hear what you're saying about 2 days. Yeah, I did a 12-day trip going into college in Yosemite, and that was brutal. So yeah, that was rough. Okay, well, let's jump in to learn about how both of you ended up at the county and doing your work in social services. So we'll stay with you, Sandra. Tell us a little bit about your upbringing and ultimately how you ended up in your role at the county.
Well, I actually feel like I got brought up in Riverside County. I started my journey with Riverside County when I was 18 years old as an eligibility technician in Medi-Cal, actually.
Okay.
At that time, I honestly thought that this was just like a stepping stone to a real job. But it turns out that this was my calling. I love helping people. I love helping the community that I grew up in. And like over the years, I've had an opportunity to work in a variety of roles and programs. I was an employment services counselor, worked in the welfare work program for a while, and that helped support our CalWorks families find stability and help find jobs, as well as help them with completing school. And then from there, I promoted into leadership roles such as supervisor, manager, and now deputy director over administrative services teams in self-sufficiency. Along the way, I actually earned my Master of Public Administration. And I really just see my role as a resource, as an advocate, a connector of our families that are vulnerable families. To help them connect to the services that we provide, as well as just make sure that I'm a resource to our staff. So I've grown up in the county and I love what I do.
That is awesome. So has your entire life, like from born and raised in Riverside?
No, I've actually been around. I've lived in Fresno for a while. I grew up in Mexico for a short time, and then came into Riverside, then moved to Fresno, came back to Riverside. So most of my adult life has been in Riverside, though.
Well, that's great. Well, I appreciate you sharing a little bit about how you got connected to your role today. And let's pass it over to Allison to hear your story.
Thank you. And I think like Sandra, many of us in this work, we actually kind of grew up starting at the eligibility level. I actually took the job of an eligibility worker while I was in college, where I was studying to become an English teacher. And I spent a few years just working with the public and the staff. And I just developed a passion for helping others. And that really just turned into this desire to wanting to help people in poverty, prevent generational poverty. And I really just got inspired by the work. That ultimately led me to change my degree and my focus. And I ended up getting a bachelor's degree in organizational management and public administration, and really wanted to take that work forward and help lead staff. So I still got to be a teacher, but a teacher in leadership. And 26 years later, I'm still here and just as passionate about the work as ever. So that's how I got here.
Well, that's cool. So both of you started at a relatively young adult age. College for you, Allison, Sandra at 18. So curious, Sandra, I should have asked you before jumping over to Allison. Did you start your role? Like, had you even joined like secondary education by the time you started your work? Or did you do your work first and then education later? Curious.
Yeah, it was actually straight out of high school. So right into high school. And then when I realized that this is what I wanted to do, I started my career in finding the right track for education to lead me into higher leading jobs. So yeah, it all started with Riverside County.
Wow, that is cool. I did not expect both of you to have started at such a young age, but it makes a lot of sense. And 26 years for you, Allison, that's really cool and so rare nowadays. But it clearly shows you probably love what you do, which is really cool. So let's jump into DPSS. Most of our audience, as I mentioned before we started to record, are California based, but we have folks outside of California as well, so they can probably relate to a DPSS department. We try to stay away from acronyms. It's funny, I'm using them all the time. I'm using them here, but can you share with the audience what DPSS stands for? And we'll start with Allison for whoever, I guess, on this question, what DPSS stands for and what work you do there in the county of Riverside.
So DPSS is the Department of Public Social Services. It does look a little bit different in each county throughout California, but relatively we administer the majority of the same programs. For Riverside County DPSS, we have 5 different divisions. And our vision is the same. It's really to support, improve, the health and safety and independence, the well-being of our communities. And that work is divided amongst the 5 of us. We have an administrative division, we have a finance division, and then we have 3 program divisions. One, which is children's services, adult services, and then mine, which is self-sufficiency. Okay. And in self-sufficiency, I could just add, we have about 2,000 staff. Wow. And those staff, they provide program assistance to 1 in every 3 county residents.
Okay.
Yes. And those programs, what we administer are our CalWorks and Welfare to Work programs, which provide monetary and housing assistance, job readiness, and childcare support. We also have our CalFresh program, which provides food assistance and also a job training component. And then we have our largest program, which is our Medi-Cal program. And within Riverside County, we have approximately 840,000 residents on the Medi-Cal program.
Wow. And may I ask, I probably should know this, but what's the total population-ish of Riverside County?
I think we are coming up on about 3 million.
Okay. Now, we don't need to get that exactly right. So sorry. Sorry for not trying to put you on the spot. So a high percentage of your residents, or a big chunk of your residents, do need Medi-Cal services. So that's really cool. I think most of our audience has probably heard of Riverside County, but a lot of folks may not realize the size. And so that's a large chunk of folks. Cool. So I may have cut you off there, Allison, but any other detail on the self-sufficiency program you think our audience should know about?
I know Sandra was going to dive a little bit deeper into how we're kind of spread out throughout the county.
Okay, cool. Sandra.
All right. Well, for our self-sufficiency team, we support residents across the county, and it's vast. We have 14 office locations, but the way we serve people has evolved quite a bit. These days, most of our programs don't require that people come in person. Customers can apply for assistance and check their case information anytime through our Benefits Cal website. Interviews are usually done over the phone or through mail. Okay. And people can even upload verification documents online. This makes the whole process so much more convenient for our residents, being that we're spread so wide in Riverside. But we also know that not everyone has reliable transportation. So some residents may not even know that some of our services exist. And that's why we operate 4 mobile outreach vans that travel directly into communities. From these vans, our staff are able to help residents learn about the available programs. We take applications from there. We even issue benefits right on the spot. And we often will team up with local cities and other county departments to make these outreach events even more impactful. And if anyone wants to know when a mobile outreach van will be in the area, they can always look up our full schedule for our community outreach branch on our Riverside County DPSS website. So we try to aim our outreach in every way that we can.
Awesome. I didn't know about the mobile vans that you guys have, and it's good to know that there's a resource online that people can see where those vans are located. You mentioned you issue benefits on the spot. What benefits are available to be issued immediately like that?
So a lot of the programs, if we take an application, or if someone comes in and they're having an issue with their benefits, we can restore benefits through these. It's like a little mobile office. Okay. So all services can be done through these vans, as well as even if they have their EBT card. We're able to even produce a new EBT card through these vans. So pretty much it's all services that can be provided in an office can be provided through these vans.
That is really neat, and something I think a lot of our audience may not have known about. So thank you for sharing that. And again, what is the, can you remind us the site where folks can learn about the locations of the mobile vans or how to learn more about them?
It's our Riverside County DPSS.
Okay.
It's .org.
Okay. Great. Thank you. Okay. So the team at Self-Sufficiency you mentioned is 2,000 people. You mentioned the different departments. So let's talk a little bit about what program changes are coming around Medi-Cal eligibility and how DPSS is helping.
Yes, so we actually have quite a few program changes that were implemented on January 1st. One of the program changes that our customers may see as we process their work is the change in property limits.
Okay.
We have reinstated the determination of property value when determining eligibility to Medi-Cal. And what that means is that if a customer has a bank account, a vehicle, maybe a 401k or a life insurance policy, we will look at the value of that property to ensure that it doesn't exceed a specific limit. In the new program, that limit is $130,000 for one individual. And then that increases by $65,000 for every additional individual in the home.
Okay.
One question we do get a lot is, does that include our primary residence? And no, it does not.
Okay.
We do not look at your primary residence as property. But this change is important because it may result in some customers being ineligible for the Medi-Cal program. And it also might slow down the process for when we're maybe processing a new application or a change, because we will require some additional verification that we did not prior to this January 1st change.
Got it. May I ask the change that just took effect here in January 2026, how long has it been since there was the existing program? Like, was it a program that was in place for many, many years that people have gotten really used to, or was it just a short-term program? Now they're back. Are they going backwards, or is it something completely new? Forgive me for
eligibility included property assessments for many, many years. In 2020, it could have been early 2021. That was the property was eliminated as part of the determination and is now being reinstated.
Got it. So this is a reinstatement, not necessarily something that was brand new, but it was something that was taken away as and made more people eligible, I guess. I would assume more people were eligible previously. Now this reinstatement is creating a challenge for folks to become medically or eligible financially for the services. What other changes, or are there other changes we should be aware of?
Yeah, actually, one of the largest changes is to our adult population, 19 to 64. And what that change is, that new applicants who are undocumented, there are a few criteria that they can be exempt from this change. But for the most part, our undocumented population will no longer be eligible to the full scope of Medi-Cal benefits. And instead, their Medi-Cal will only cover emergency and pregnancy-related services. Existing customers who were already on the Medi-Cal program that are undocumented will continue to receive the full scope of Medi-Cal benefits.
Okay.
As long as they continue to submit requested verifications and reports. So it's imperative that our active customers are turning that in. Otherwise, they lose the full scope of benefits.
Oh, okay. Can I ask a clarifying question there?
Sure.
So if I'm a Medi-Cal beneficiary, but I'm undocumented and I'm 21 years old and I was previously active, let's say with IEHP in Riverside County, which I believe is the biggest provider of services, I can still maintain as long as I follow through on the paperwork. Did I understand that? Okay. Yes. But if I'm new to the country, let's say, or I'm a new applicant, that's where I don't have that grace, I guess. Is that fair to say?
New applicants, yes. Anyone that is applying for Medi-Cal services January 1st and thereafter will have the limited Medi-Cal.
Okay. Gotcha. And then are there any other requirements besides paperwork, like any fees or anything like that folks should be aware of?
At this time, no. There are some additional changes another year down the road that are not fully vetted. But at this time, it's really around the benefit kind of eligibility. So the last big change January 1st is that all Medi-Cal recipients, regardless of immigration status or age, lost dental coverage. So there's no longer dental coverage as part of Medi-Cal.
So if I have, that's tough. Wow. Do you have any other, are there any other resources that you're aware of for folks? Not to put you on the spot, but
we do try to connect individuals to any other, local entity that may be of assistance. We don't usually connect them with individual dental offices, but if we know of a program, and then we work closely with our other county partners who may also be aware of additional resources for our customers.
Okay, gotcha. That's good to know. Okay, so 19 to 64 existing members will have some grace and still be able to get their Medi-Cal. New will not. There might be some changes next year that have not been fully vetted that might adjust maybe some fees. Again, you're not saying there are going to be fees, but there could be changes in 2027, and people should stay up to date with DPSS and other resources in case there's other.
There are a few that, Sandra, if you want to touch on, that we know are going to be coming that people may want to be aware of.
Yeah, in the next 12 months, we are expecting even more changes to Medi-Cal. Okay. We already know that there are several updates that will impact the adults, citizens between the ages of 19 and 64, including some with disabilities. And some of these changes are the requirement to work or participate in a work or community engagement activity to keep the coverage. There's also a requirement to renew benefits every 6 months instead of every year. And this could potentially increase the potential to lose coverage, as well as, it'll create additional work for the counties.
Yeah.
And then the last one is the timeline to request retroactive coverage for Medi-Cal prior to the application is reducing from 3 months to 1 month. So it's really important with these significant changes that those individuals relying on Medi-Cal stay informed, as a lot of these are still in the works. There's still a lot of information that we're trying to understand a little bit better and how that will impact our team and our residents. And so we'll continue the outreach as we get more information as well.
Got it. So there's a lot of both real information and that are facts, and then possible changes. So it's probably hard to keep track of everything that's going on. Are there any myths out there that people are hearing or thinking with all of these changes?
As we're trying to understand a lot of this, we're also meeting consistently with our state partners, as well as trying to get information from the federal government. But we're trying to understand it all as well. So I can tell you that the biggest thing is, before we say I'll share any information, we just want to understand it best ourselves, just because there's so much changing. And I can't think of any myth in particular, because there's so much that is coming our way. Yeah.
Well, I guess I know I misunderstood the 19 through 64 situation based on, I think, what other people told me. So that was what I'd heard from other sources was incorrect. So I appreciate some of the things you guys are sharing as the leaders here in the county of Riverside. What Allison or Sandra, I know Allison previously mentioned like there might be other resources for dental, but are there other support systems just in general there in Riverside County that folks can tap into besides DPSS that you would recommend as good resources or reliable for all these changes? And I'm guessing DPSS can't do this on their own, even though you guys are the leaders and you have staff, but the community support is always helpful. So any recommendations there?
Yeah, so in Riverside County, we actually have a county-wide initiative, which we call RivCo One. And really what we have, I should say, implemented is an integrated services system, so that any resident who comes into a county agency can be assessed through a whole person assessment, a whole person healthcare assessment, and we're able to connect them to other departments throughout the county. That has been extremely beneficial in being able to determine an individual's needs, and it may be more than what they came in for.
Yeah.
So that's one way in which we are really trying to make a web of our services around this customer that comes in. Additionally, a lot of our support comes through opportunities like this, working with community partners who are able to share resources with us when we share information with them.
Yeah.
And as Sandra mentioned, in our community outreach. So also in Riverside County is what we call our RivCo radar. And it is where it is not just DPSS that goes out into the community. There are various other departments that have either their own event or they're attending events. So there's just this opportunity to really share resources and being out, really where the customers are at and sharing information, educating them on what changes are coming, what programs they might be eligible for. That's a really big, impactful part of our work. And I'll go back to whether it be a podcast, whether it be an opportunity to present at a board meeting or something of that nature. It's really the information sharing that is key to being able to, whether we're trying to get rid of myths, just educate individuals, or support the community.
Awesome. That's great. And I know a lot of Medi-Cal members seek the information, which is good, but some don't, right? So no matter how hard we try, there's still going to be a lot of folks who just haven't heard. So I think that's really good. So what is the best way for folks like with DPSS, with the information? Your website, I'm guessing, is the best place online to stay up to speed. Any other recommendations before we wrap up today's episode there?
Can I just share one thing? I gave you the wrong website. It's rivcodpss.org.
Okay.
Just wanted to make sure you had that. And then when we talked about myths, and I was thinking you were addressing like the House Resolution 1, I wanted to share some myths that we do here just for our services, if I can.
Yeah, please.
Okay. So just a few, like the big one is the data sharing between our departments. So sometimes people think that when they turn in verifications or any documents to any county department, that they assume that we automatically will receive that information. In some cases we do, but we don't always share information across departments. So if we're asking for information, it's because we don't have access to it. So please get it to us, because we're not trying to make things harder for anyone. The goal is to try to process the case as accurately as possible. Another concern that we hear about is having to come into our offices. And the truth is that most of the time, you don't have to. So you can avoid long lines and wait times by checking your mail regularly. Yes. And sending back any requested documents using our prepaid envelopes that we provide. You don't need to stop by. And if you do stop by, you can use our self-service kiosks. We also have drop boxes at every office. And in many situations, you can upload your verifications directly onto benefitscal.com. which often is the fastest way to get information to us. And then the last myth that we hear is we get a lot of people asking about emergency Medi-Cal. So like when people are having a medical emergency and they apply, they're expecting that our application is going to get processed really quickly. But because of the high volume of applications that we receive, processing may not always be right away. But just the important piece is don't delay getting any medical care while you wait for the application to be processed. Once you apply, your application date is protected. And if you qualify, you can request retroactive Medi-Cal for up to 3 months back. So from the date that you applied. And then as soon as we get that application processed, the coverage will be applied to your case once it's approved. So those are just a few of the big ones that we hear a lot, just in relation to Medi-Cal.
Yes. Yeah, Medi-Cal eligibility specifically. Thank you for clarifying there, Sandra. And that's a lot of good info. And I think I wrote down some notes incorrectly. So I just want to clarify, today in 2026, retro eligibility, is it 3 months or 1 month? Forgive me for not writing it down clearly.
Today is 3 months.
Today is 3 months.
Back. Mm-hmm.
Okay, awesome. Okay. Well, anything else, Allison or Sandra, that you think the folks should know about your work at DPSS, specifically around eligibility and your department, the self-sufficiency department?
Well, I want to first thank you for even giving us an opportunity to come on and share what is happening. These changes to the Medi-Cal program are not unique to Riverside County. It's the entire state. So if this podcast is heard in other counties, the same changes are happening. And so that same, community outreach and education is so important in being able to maintain benefits. So this is a great platform for being able to do that. And yes, if anyone is interested in learning more about the county, our websites are obviously a great place to get that information and to connect with us. But in addition, if anyone is interested in learning about our outreach, processes, our outreach vans, or even, having us present or share information with them, they can definitely reach out to me, to Sandra, or even through you, Gavin, and we would be more than happy to share our resources and our information.
Okay, awesome. And is the best way to connect with you or your department just via the website? I don't want to necessarily give out like your personal cell phone number or anything like that. What recommendation would you have if people want like a community presentation or something like that?
The website is great. My email is perfectly fine. We'll route that to the right individual.
Okay.
My email address is avgonzal@rivco.org.
Awesome. Well, that was AV as in Victor, or see that?
Yes.
Okay.
AV. Yes.
All right. Awesome. Great. Well, thank you, Allison, and again, Sandra as well, for being great resources for us. We've been talking for, a couple months since I first met Allison. So glad we can finally make this happen at the beginning of the year. And I think it's a great topic going into 2026. So again, appreciate you both for joining the show today.
Appreciate you. Thank you.
Thank you.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.